with COVID-19, even those who have deceased. Individual that we originally classified as related to COVID-19 did not meet the criteria to actually be a COVID-related death. As a result of that investigation, we reduced the cumulative number of deaths in the state related to COVID-19 for today from 124 down to 123. As a result of that investigation, we also decreased the total number of cumulative hospitalizations down by 1 as well. This is part of the investigation process that, as I mentioned, we do for every single individual case that's reported to us. This has happened before. In fact, not too long ago, we encountered a similar situation. And really what it speaks to is how dynamic outbreak situations are. The information that gets reported to Maine CDC on Monday may change on Tuesday based on the investigation that we do into each and every one of these situations. As these situations occur in the future, we'll make sure that we update individuals and that we update the public based on the information that we find as our investigations proceed. Now on to the numbers. Overall, there are a total of 3,975 cases of COVID-19 statewide. That's an increase of 5 cases since yesterday. Of those cases, 3,548 are confirmed, an increase of 7, and 427 are probable, a decrease of 2 cases. In this situation, these are 2 individuals who were part of our contact tracing process and were being monitored by our IT program called Sarah Alert. They ended up getting tested and were tested negative, and thus were removed from the probable category. Overall, 388 individuals have been hospitalized. As I mentioned, that's a decrease in 1 because of the investigation I mentioned. And right now in the state of Maine, there are 12 individuals who are currently hospitalized, one of whom is in the ICU and one of whom is on a ventilator. Overall, 3,424 individuals have recovered. That's an increase of 28 since yesterday. And of our cases, 905 are among healthcare workers. Overall, since beginning our response to COVID-19, Maine CDC epidemiologists have fielded now 11,300 consultation requests from healthcare providers across the state. I'd like to next provide some updates on some of the outbreaks that Maine CDC is most closely involved. Let's start with one that we just closed this morning, and that was an outbreak at Ready Seafood, which we closed this morning after a total of 11 cases associated with that facility. There are a number of pending and open outbreaks that we continue to remain involved with. At Central Maine Medical Center, there are now a total of 14 cases of COVID-19. The second round of COVID-19 testing that the hospital undertook among different staff, most notably among ICU staff, the results of that testing came back and all staff were negative. CMMC is doing a subsequent round of testing focused on staff in a different wing of the hospital, and we hope to have results from that testing tomorrow or on Thursday. At the Marshwood Center in Lewiston, there are a total of 23 cases there. When we spoke last Thursday, Marshwood was at 21 cases. So they've increased by 2 cases just over the past few days. Marshwood is continuing to undertake rounds of testing to determine whether both staff and residents have cleared out their COVID infections. I'd like to provide an update now on outbreaks that we are working on affiliated with agriculture establishments and farms across the state. At Hancock Foods, there are now a total of 10 cases of COVID-19. And at Merrill Farms, there are a total of 9 cases of COVID-19. We've also opened up an outbreak investigation this morning into another farm, this one at Wyman's in Millbridge. where there are a total of 4 cases of COVID-19 that have been detected thus far. As with the other 2 establishments, Wyman is working very closely with our colleagues and partners at Maine Mobile Health to undertake widespread proactive testing of arriving workers. They have tested nearly 170 individuals, and they're finishing that round of testing today or early tomorrow morning. Thus far, they've detected 4 cases, and those cases are, 3 of those 4 cases are reflected in today's case count. I'd also like to make a quick announcement based on concerns that were raised to Maine CDC and DHHS from our colleagues at MDI Hospital. Commissioner Jean Lambrou, the Commissioner of the Department of Health and Human Services, Commissioner Lambrou and I had a very productive meeting earlier today with MDI Hospital President Blank and a member of his senior management team. We're thankful for the opportunity to have had that meeting. At that meeting, President Blank and his team raised a concern that they have had on MDI around individuals here in Maine who are not Maine residents and the potential of close contacts of those individuals who may have been affected by COVID-19. Over the past week and a half, approximately 5 individuals have reached out to MDI Hospital. And I commend MDI Hospital for providing those individuals with prompt, accurate public health guidance. These are not Maine residents, but these are individuals of other states who had just recently received their positive test result from their home state. Our colleagues at MDI provided them with prompt, accurate public health information in terms of staying inside and isolating so as to avoid spreading COVID-19. But there remained a concern about the close contacts of those positive cases. We discussed that concern extensively. And again, I'd like to thank MDI President Blank for raising this issue with us. We agree with their concern. That's why, as a result of that discussion, we are announcing a pilot project under which MDI Hospital will begin using Maine CDC's electronic contact tracing system called SARA Alert to enroll the close contacts of these confirmed cases so that they can benefit from the same symptom monitoring that other close contacts of cases here in Maine have already been benefiting from. That process should be rolling out soon, and based on the very productive discussion that we had today, we look forward to seeing how this system works and how we can use it to keep everyone in Maine safe. I'd like to next provide an update on some of the testing statistics that Maine CDC is tracking. Let's start with the positivity rate. Based on 1,613 total PCR tests reported to Maine CDC, the one-day point positivity rate here in Maine was 0.8%. That brings our 7-day weighted PCR positivity rate to a new low of 0.87%. For comparison, the national average for PCR positivity stands at about 8%. And again, the 7-day average in Maine is 0.87% right now. Testing volume in Maine has remained steady at approximately 176.5 tests conducted for every 100,000 people in Maine. And finally, a brief update around positivity rates and testing volumes among out-of-state individuals. As of this morning, there have been 170 positive test results among out-of-state individuals. That's an increase of 11 since last week. As a reminder, these are positive test results. Many individuals may be tested multiple times as part of their standard medical care. Also, as a reminder, a significant fraction of these 170 results are among residents of states such as New Hampshire. These are folks that may get their health care in Maine and just happen to live across the border. Before we turn to questions from our colleagues in the media, I wanted to take a moment today to provide everyone an update on one of the questions that I think we get more than any other at Maine CDC, which is what's going on with vaccines? We at the Maine CDC have been working on issues surrounding a potential COVID-19 vaccine for several months now. And I wanted to take a moment today to provide everyone an update both on the science as well as what Maine CDC is doing to plan for a rollout, and finally, what you can do right now to start planning for the arrival of a potential COVID-19 vaccine. Let's start with the science. Right now, researchers around the world are racing to develop over 160 vaccines against the virus that causes COVID-19. Of that work, again, approximately 160 candidate vaccines are being developed and studied right now. Of those 160, about 27 are currently in human trials. And according to Dr. Fauci, the goal of this approach is to produce a viable human COVID-19 vaccine as soon as possible. Now, work on these vaccines began developing in earnest not long after the virus's genome itself was sequenced earlier this year, way back in January. The first safety trials in humans began in March of this year. Now, to be sure, no one, not even Dr. Fauci, knows when a vaccine will be fully developed and ready for rollout. The road ahead with respect to COVID-19 vaccines is uncertain. Along the way, some of the trials of one of the 160 vaccines that I mentioned may not succeed. Other trials may yield equivocal results. But ideally, some of these candidate vaccines will succeed in safely generating an immune response and conferring herd immunity among the population. If all of that works, we will be that much closer to moving back towards some semblance of the pre-COVID-19 world. I wanted to spend a moment talking about two of the candidate vaccines that have started entering more advanced human trials. One is being developed fundamentally by a United States-based biotech company called Moderna. Their vaccine is based on what is called messenger RNA, and that's used to produce viral proteins in the body. In partnership with the National Institute of Health, Moderna found that the vaccine that they've been developing protects monkeys from the coronavirus. In March, Moderna put its first COVID-19 vaccine into human trials and found promising results. After carrying out a phase 2 study, they launched a phase 3 study later in July, not long ago, on July 27th of last month. The final trial will enroll approximately 30,000 healthy people at approximately 90 sites around the country. The US government has provided Moderna nearly $1 billion in financial support. The other vaccine that I wanted to take a moment to discuss is one that's been under development by an association of the British-Swedish company AstraZeneca in partnership with researchers at Oxford University in the UK. This vaccine is based on a chimpanzee virus. And also there, a study in monkeys found that the vaccine provided those monkeys protection from COVID-19. In May, the United States government awarded this group approximately $1.2 billion. And their phase 1/2 trial, a hybrid trial they conducted, reported that the vaccine was safe, causing very few side effects. In addition, it promoted and prompted the immune response among humans that we know to be vital for the vaccine's overall success. The vaccine is now in a hybrid phase 2, phase 3 trial in England, as well as full-on phase 3 trials in Brazil and South Africa. According to AstraZeneca, their total manufacturing capacity for this vaccine, if it is approved, stands at approximately 2 billion doses. I'd like to take a moment to talk about what Maine CDC is doing to prepare for the potential arrival of any of these vaccines. Let me be clear. We're not waiting for a vaccine to be approved and start shipping before we start planning on how to implement and roll it out across Maine. For months now, teams of individuals at the Maine CDC under our immunization program have been working with state partners, healthcare providers, and numerous different stakeholders to start thinking about how to offer any COVID-19 vaccine to large numbers of folks across the state of Maine, quickly, safely, and efficiently. No final decisions have been made. The planning is very much underway right now. But it involves grappling with some very challenging issues, such as thinking about who should be vaccinated, how they should be vaccinated, and when they should be vaccinated. Thankfully, we need not make these decisions in a vacuum. We're working closely not just with stakeholders within Maine, but with our colleagues across the country at state public health departments and city health departments across the country to think through these difficult issues. We also have the experience from 2009 with the H1N1 influenza vaccine, which was instructive and helps give us some guideposts about how we should be thinking about this issue. But what should you and your family be doing now to provide or to prepare for any potential arrival of a COVID-19 vaccine? The first thing that you can do is make sure that everyone in your family is up to date with all of your required and recommended vaccines. This includes not just your kids, but adults as well. To help that process, Maine CDC has launched a series of vaccine catch-up clinics across the state, a partnership led by our public health nursing program, as well as the Maine CDC immunization program. Through these clinics, children can visit them and make sure that they have all of the recommended doses of their vaccines. I also recommend that you touch base with whoever your primary care provider may be, adult and child alike. That way you can reestablish that vital relationship so that when a COVID-19 vaccine is ready to go, you've got that relationship resurrected and ready to go so that if you've got questions about the vaccine and whether the vaccine is right or appropriate for you and your family, professional guidance from your healthcare provider will be a phone call away. It's important to keep up to date with your vaccines, but it's also important to keep up to date about vaccines. The latest news on vaccines is now more important than ever to follow. And let's be honest, the topic of vaccines stirs people's passions and emotions. If you ever want to liven up a boring family Zoom chat, start talking about vaccines. These passions underscore the need right now to stay up to date with the latest news about vaccine via reputable sources. As always, I recommend checking sources like the World Health Organization, the US CDC, and the Maine CDC for up-to-date, timely, and accurate information about where things stand with vaccines and what the timeline for any potential vaccine rollout might look like. I will do my best through these meetings to try to keep everyone updated as the science evolves and as the regulatory process unfolds. So with that, I would like to turn things over to our colleagues in the media. Today's first question goes to Emily Tadlock at WABI.
Hi, Dr. Shah. Thanks so much. You've reported on 2 outbreaks in Hancock County and now one in Washington County as well, where essential workers are coming in from out of state and out of the country and are being diagnosed with COVID-19. And you told us last week that these individuals are being quarantined in Bangor. Can you tell us more about that and exactly how many are being quarantined in all, including their families? Where in Bangor, where is the money and the resources coming from that's being used to care for these people?
Sure. So Emily, what we've undertaken is a system under which individuals who either have been confirmed to have the virus or individuals who have been closely exposed to those individuals are provided a safe, supportive place where they can finish out their quarantine process. That is at that's at a location in Bangor. For a number of reasons, privacy among them, we're not disclosing where, but those individuals are provided a safe, supportive place where they can remain and through their quarantine process, make sure that they've got all the supports they need so they can get back to work. The funding from that comes from various different pools. We can get you additional information on that. And the exact number changes from day to day based on, for example, how the testing process is unfolding. So it changes as individuals come in, as individuals are then released from their quarantine. So it does change. We can get you, again, the exact number of individuals right now, recognizing that it may change over the next 6 hours. But our approach here is to make sure that any individual who has had a close exposure to a confirmed case, as well as the confirmed cases themselves, are provided a safe, supportive place where they can undertake their isolation in the case that they've been confirmed, or their quarantine in the situation where they've been exposed.
Could I ask one more question?
Sure.
This pilot project you mentioned at MDI Hospital, do you think it's going to be enough to alert our residents of positive cases from an out-of-stater that they may have come in contact with to protect them and keep our numbers here in the state from surging?
We think it will. This system will be the same system that's used for individuals who are Maine residents. So it builds on that same infrastructure to make sure that individuals who have been close contacts with confirmed cases are enrolled, that they're provided symptom monitoring, and in the event that they start showing symptoms, are given precise instructions about how they can access testing. I'd like to turn next to Bob Evans at News Center.
Thank you, Dr. Shah. The Trump administration recently announced a plan to provide every nursing home with a fast COVID-19 testing machine. But now they're saying they won't be supplying enough test kits for those machines to check staff and residents beyond a few initial rounds. Has there been any discussion about this on the state level?
Bob, there has been. We received word not too many days ago that there would be 3 facilities in Maine that would be among the first in the country as part of this initial allotment of 2,000 machines. There would be 3 facilities in Maine that would be among those that would be receiving them. We can get you the exact ones. It was Seal Rock and 2 others across the state that would be receiving these machines. Some of the important considerations here is, one is that these are really to be used when individuals, be they residents or staff members, start showing symptoms. What we've learned about some of these devices is that they work best and yield the most accurate results after individuals start displaying symptoms, not before they start displaying symptoms. So we're starting to work with the facilities that we know will be receiving them to provide them that guidance. Otherwise, there's the possibility of inaccurate results. We've also heard concerns about the number of test kits that would be provided. That raises its own set of issues and concerns for us. So we've been starting to reach out to facilities, not just these 3 facilities, but facilities across the state to make sure that independent of these testing machines, these nursing facilities across the state have a plan in place to test their staff on an ongoing basis as COVID-19 unfolds across the state. So these 3 facilities that will be receiving the machines, that's a good start. We're hoping for more that find their way to Maine. We're also hoping for more robust testing supplies. In the meantime, if there is a confirmed case, let alone an outbreak at any of these facilities, Maine CDC has a plan and has been working that plan to assist facilities in conducting widespread universal testing. I'm going to turn next to Patty White at Maine Public.
Thank you, Dr. Shah. I know that building up the number of contact tracers in Maine is ongoing. Can you tell us how many we have at this point and how quickly they respond when a positive case comes in?
Sure. So Patty, we've got about 100 contact tracers and case investigators at Maine CDC right now as part of the overall team that, again, is looking into cases as well as contacts. Our goal is to make contact with confirmed cases within about a day of the individual receiving their diagnosis from their healthcare provider. After that, the case investigator generates a list of close contacts, which are then moved over to our contact tracing unit, which then enrolls those individuals into SARA Alert, which is our electronic symptom monitoring platform. So our goal is to have that entire process done as quickly as possible after the diagnosis is delivered back to the patient.
And the goal is within a day. Is that typically, are the contact tracers able to do that?
That's for the case investigators. The contact tracers are checking in with contacts. Case investigators are checking in with the case. And yes, they are able to touch base with most cases within the 24-hour period. Now, sometimes the phone number that we have is not the accurate one, so it can take maybe a little bit longer to get in touch with the doctor's office to get the right phone number, things of that nature. But one of the metrics that we track internally is to make sure that we are touching base with all cases as soon as the diagnosis is delivered to them by their doctor.
Got it. Thanks.
Mm-hmm. I'd like to turn to Eric Russell at the Press Herald.
Good afternoon, Dr. Shah. Thanks for taking my call.
You bet, Eric.
So I had a quick follow-up question about MDI as well. So I know that when the governor and others sort of put this testing alternative as an alternative to the 2-week quarantine, it was meant to sort of salvage, a little bit of the tourism industry. But given what's happened now and given some of the major challenges with getting test results in a timely fashion, is it really the best idea for people to be coming here before they get their test results? Because it seems like that's what's happening with a lot of these folks down east. And, it doesn't really do them any good if they're, positive, but don't know it for a week and a half if they're still hanging out here. I wonder if you could talk about that at all.
Sure, Eric. So one note with respect to the testing requirements, Maine was among the first states to put into place this system whereby individuals who were coming here needed to have a negative test. A number of other states have now followed suit and followed Maine's example in this regard. I've heard from colleagues across the country who have wanted to replicate the exact system that we've got here. And so I think that speaks to the fact that other states are coming around to the idea that if folks are going to be coming into their jurisdictions, the best thing to do is to have them have a negative test in hand. The other piece of that, Eric, is that you characterize that as a lot. I'm not going to dispute that characterization. I will note, however, that per the conversation we had with MDI President Blank this morning, hospital president, he indicated that there were about 5, maybe 7 individuals over the past week and a half. As a fraction of the overall number of tourists, I don't know what that would be, but I think that context is important. But the third and most important piece, Eric, is that our guidance is clear. If you are coming to Maine before you've got your negative test result in hand, you should absolutely be quarantining until that result comes in. That does not mean limiting your contact when you go out to eat. It means not going out to eat. It means staying in your hotel room. It means not leaving and exposing anybody. That is the essence. If individuals follow that, which they should be, the theoretical number of contacts with Maine people should be very low. The only number of contacts should be among individuals who, for example, the positive case may have traveled with. So I think the system requiring a negative test and requiring strict quarantine until the negative or the positive or negative result is known, I think it works. We've got to make sure that folks follow every step of that and not just assume or presume that, hey, I got a test, I'm sure it's going to be negative, so I'm going to go out to eat here while I'm in Maine. That doesn't work. The system requires folks to be responsible and not expose others while they're waiting for their test.
Thank you.
You bet. I'm going to turn next to Amy Brown at WERU.
Thank you, Dr. Shah. I have 2 questions that come from 2 different listeners who are teachers. The first says, I would like to get clarity about the rationale of the 3-foot distancing requirement for children in schools, which means that they'll be spending nearly all day inside with only 3-foot distancing, except for eating when they're unmasked. And the adults have to stay 6 feet away from the students. What was the scientific rationale for only 3 feet of distancing in schools while it's still 6 feet everywhere else? And has the recent outbreak at the camp in Georgia influenced your thinking? That's the first listener's question.
Sure. So let's talk about the outbreak at the camp in Georgia. When you take a look at the data and the publication that they put forth, one of the most glaring things that immediately jumps out is that face coverings were not worn, or as the article said, I think worn inconsistently and unevenly. The 3-foot analysis, it comes from the American Academy of Pediatricians, which undertook a thorough scientific review of all the data out there. And based on the American Academy of Pediatricians, a group that focuses on the health of children, they found that when face coverings were worn, 3 feet distance did not introduce more risk than 6 feet without face coverings. So when you compare what we've recommended and a number of states have adopted based on the American Academy of Pediatricians analysis, when you compare that to the outbreak at the camp in Georgia, what you see is that the face coverings make all the difference. Far from being an obstacle to achieving in-class education, face coverings are the vehicle for which in-class education could be more safely accomplished. And again, this comes largely from the analysis undertaken by the AAP, which is available on their website.
Okay, thank you. And another teacher asks whether you anticipate providing a count of the number of school workers who have tested positive as the school year starts, as you've been doing with healthcare workers.
It's under consideration. We've got to make sure that before we go down that route, we have a way to make sure we're capturing those data completely and not providing a partial look at it. So if we're going to report a number, we want to make sure it's full, accurate, and complete. And so we're having discussions right now with our case investigators to make sure we can ask those questions in a way that we can then put that data on the website.
Thank you.
Mm-hmm. I'm going to turn next to Charlie at the BDN.
Yes, hi, Dr. Shah. Thank you. So my questions are about the antigen testing systems that are being provided to nursing homes, following up from earlier. The first is basically given the fact that those tests are not 100% accurate or not as accurate as PCR tests, how are you advising that Maine nursing homes actually use them? If they're not ideal for catching, asymptomatic or pre-symptomatic COVID cases, what's the value of them, and what advice would you give to nursing homes that are using them?
Sure. So Charlie, let me start by I just quickly pulled up the list of the 3 facilities in Maine that will be among the first to receive these rapid point of care COVID diagnostic machines. One is Seal Rock, the other is the Marshwood Center, and the third is Coastal Manor. That list was generated by the federal government, not by Maine CDC, based on their analysis of the data in Maine, not Maine CDC's analysis. So the advice that we are going to be giving to these facilities, these 3 plus any others that acquire point of care machines, is really to use them to get a quick sense to either rule cases in or rule them out. So if an employee or a resident starts displaying any of the symptoms of COVID-19, to immediately use one of the machines to get a sense of where that person is. If it's positive, based on what we know right now, a positive result in a person with symptoms from one of the antigen machines is quite accurate. That's a measure called specificity. The specificity of these machines is very high, and a positive result is strongly indicative of COVID-19. A negative result, however, doesn't mean you stop. A negative result really is something that suggests the possibility for a follow-up test to be done at the Maine CDC laboratory. So if an individual has symptoms or if a staff member has symptoms, the rapid test helps you get a sense of where they are. If they test positive and it's say a staff member, that staff member can not really interact with patients and thus limit the exposure. And you can make that determination in 10 or 15 minutes. If the positive result is in a resident, the resident can be immediately cohorted and limited from exposing or interacting other individuals while further investigation is underway. What we know about COVID-19, especially in vulnerable populations like nursing homes, is that every minute of exposure matters. And so if you can take somebody out of the milieu because they've gotten a positive and limit their interaction with a staff member or other residents, you've got that much better of a shot at preventing one case from turning into 20 cases. Are the tests perfect? Certainly not. That's why the protocols call for follow-up tests at the Maine CDC lab, consultation with Maine CDC epidemiologists, things of that sort. But they are a very good start and can really help shave hours and hours off the process, because we know in situations like that, every minute matters.
Just a quick follow-up on that. So you would not, what would you suggest? Would you not advise this for, say, just if you wanted to test a resident who is being admitted and doesn't have any symptoms, would that not be a good use of this system?
According to a recent change by the US FDA, these machines, these antigen machines, to be precise, it's the antigen machines in particular, separate and distinct from the Abbott ID Now machine. The antigen machines are best used with individuals who have symptoms, as opposed to, in the scenario that you mentioned, Charlie, someone with no symptoms at all. And that's a recommendation that's buttressed by the US FDA.
Okay, thank you.
You bet. I'm going to turn to Ashley Blackford at WAGM next.
Hi, Dr. Shah. I have two questions for you. The first, I'm just wondering if there's any update on the outbreak at Walmart here in Presque Isle.
Sure thing, Ashley. There are still 3 cases at the Walmart up in Presque Isle. Investigation is still underway. No definitive source or cause of the outbreak has been identified yet. But again, our investigation is underway. There have not been any new cases in quite a while now, which is a promising sign.
Okay. And when it comes to numbers, now I know sometimes there are revisions made to the previous day's numbers. So for instance, today, I know some of us in the media have reported 5 new cases, while others have said 11. Is there a way for us to know of the changes made so we're accurately reporting the correct information? And what is the correct number for today for new cases? So,
Ashley, I have been reporting cases the exact same way since day one. When I report cases, I talk about the total number that's changed since yesterday, and then the various individual breakdowns that go into that, namely changes in confirmed cases, which usually only tick upward, and probable cases, which can tick upward and downward. So the number that I am reporting today is 5 additional cases total. That's again comprised by 7 additional confirmed cases and 2 fewer probable cases. That's the way that I've been reporting these cases since day one. I know that there's been some variation in the way that different members of the media have reported them. I understand that, but I haven't changed the way, Maine CDC hasn't changed the way that we approach these. I am going to turn next to Liz Graves.
Thank you, Dr. Shah. Hi, I have a couple of questions. Some of them are very fast lightning round.
Great.
So the first is about, I wanted to make sure everyone's clear, 72 hours, the 72-hour number for visitors getting a test before they come. That 72 hours refers to you get your result within 72 hours of when you leave home. What is the 72-hour mark?
Great. Glad you asked that, Liz. The 72-hour mark is when the specimen should be taken. It should be taken no longer than 72 hours before you arrive in Maine.
Okay.
And this is lightning round, so I won't go into that. I won't go into more.
Yeah, it does bring up more things, but we can do that next week or Thursday. So lightning round 2 is, you just mentioned super helpful in your answer to Patty about case investigators and contact tracers, and case investigator does their work in that first day from when the person receives their result from their physician. And I'm just curious whether that's the same if they didn't go through a physician referral process.
The answer is yes. I'm going to resist the temptation to say more because it's lightning round, but the answer is yes.
2 lightning rounds. Okay, great. So the 2 more, actually, the only bigger question is, and you began to answer it too a moment ago, it's this question, the concern about cases among non-residents has brought up more questions and concern about what quarantine means. And the Maine CDC website says you cannot go out to public places. Some other guidance that's being issued to visitors says it is okay to hike or bike or swim in uncrowded areas, and there seems to be vast confusion about whether it's okay to grocery shop.
Yeah, so the essence of being in quarantine is not interacting with anybody that you haven't interacted with thus far. So you can quarantine with the family members that you drove up with in the car. You can quarantine with the traveling companions that you took the bus in with. But the essence of quarantine is not interacting with anybody whatsoever that you have not yet interacted with. So if you are staying in a cabin and you feel like you can go outside in the yard of the cabin or even go for a walk down an old country road, knowing with confidence that you will not interact with anybody at all, then quarantine can be safe. You're not introducing any new risk. But if you're staying in downtown Bar Harbor and you want to walk around the square, it's going to be really difficult to do that and not interact with anybody whatsoever. That would not be an appropriate thing for someone in quarantine to do. The same thing applies with grocery shopping. Going into a grocery store when you're in quarantine, there's no way you can do that without interacting with somebody. But could you say order your groceries online and have them pick it up, set them by the curb, and then wait until there's no one around you whatsoever, and then put them in the car? That's feasible. It might be a challenge because grocery stores can be crowded and you can't really guarantee that no one's going to cross your path. My view, my recommendation is that one of the safest ways to go about this is that if you're planning on coming to Maine, and probably not too many folks are watching who are planning to come to Maine, but if you're planning to come to Maine and you don't have your test result yet, you should plan not to interact with anybody. For example, even at curbside pickup at the grocery store until you've got your negative result.
Okay, wonderful. The last question is pretty fast too, I think, and I want to preface it by saying I so appreciate all of the data CDC has worked to provide to all of us and all the updates and clarifications. I'm curious about 2 breakdowns. One is, why is the zip code data appears to lag a week or so or more behind, and is there any reason for that, or is it just a lot of work?
Yes, no, there is a specific reason for that. So it all comes down to privacy. We build in a time buffer because if you happen to know somebody in a particular zip code and you happen to know that they were sick, and then the next day you see that there happens to be a new case in that zip code and there's not many other people in that zip code, there's a pretty good chance that folks could figure out that that person is someone who had COVID-19. So we build in a buffer to make sure we continue to protect privacy.
Awesome. Okay. And then the related question is, has there been any discussion about breaking down the out-of-state cases by county where they were tested or reported?
We haven't gone down that road yet. And, again, I want to be honest. I want to be straight with everybody. We should be going about our lives here in Maine with the assumption that COVID-19 is all around us. And if you're waiting for a particular number on our website, if you're waiting until the number of out-of-staters in Hancock County goes above 7 before you start taking more precautions, that's risky. The virus is here. It's everywhere across the state. It may be in some places of the state more intensely than others, but as we've seen, there have been outbreaks in almost every corner of the state. We've had outbreaks in Holton. We've had outbreaks in Presque Isle. We've had outbreaks in areas that we wouldn't normally think of. And that's because people travel. So I've talked about in the course of a day, it's conceivable that I could go through 3, 4, or 5 counties, and everywhere I go, I could potentially bring the virus with me if I were positive. So for that reason, we don't want to give folks a false sense of security. We want to properly equip everybody with the data so everyone knows what's going on, but no singular piece of data on our website should be the difference between whether you start taking precautions or whether you don't take precautions.
Thank you so much.
You bet, Liz. I'm going to turn next to Patrick Whittle at the AP.
Thank you very much. Thank you very much, Dr. Shah. We saw some guidance yesterday regarding daycares from the Office of Child and Family Services that is suggesting facial coverings by staff and children 5 and above, and recommended 2 to 4. I'm kind of curious why this guidance is coming out now, because daycares have been open a while. And additionally, just back on the subject of MDI, do you think you could provide a little bit more detail about exactly what kind of support services that the CDC is providing to MDI as they try to sort of corral this potential outbreak?
Yep. So let me start there, Patrick. This is not a potential outbreak. We're not labeling this as a potential outbreak. It's approximately 5 individuals who have called the hospital because they have been told by their state that they have had a positive result. There's no indication that these cases are epidemiologically linked in any way, et cetera, et cetera. So we are not considering this a potential outbreak, a possible outbreak, a probable, just to be straight on that. What we're providing them is a module within Sarah, within the IT system that we've got, that we use to conduct symptom monitoring. And typically, Sarah Alert has been used by hospitals to conduct symptom tracking of individual patients who may have been in their facility and, say, been exposed to a healthcare worker who later test positive. We're adjusting Sarah Alert to make it useful for this situation, for this use case, which is individuals who have called and have said, I just got a call from my state, from my doctor in another state, who told me I'm positive, and these are all the people I've been traveling with, and this is these are the people in my car, and I want to make sure that everyone stays safe. We're adjusting the system so that MDI Hospital, and I thank them for their partnership and their desire to step up in this fashion, MDI Hospital has volunteered to step up and say, yep, we'll enter those people in, and those individuals will then get a text message, a phone call, or an email to check in on them and see how they're doing. If they've got symptoms, then they can be arranged for testing. Your former question, Patrick, was about daycare centers. Really what this is a recognition of is 2 things. One, the need to make sure we harmonize it with the same equivalent rules that exist for the educational system. The other is, again, increasing data, showing the importance of and the value of face coverings, even as that may as challenging as that may be in younger kids, the value that can have in keeping them safe. I think Amy mentioned a moment ago a recent publication detailing an outbreak at a camp in Georgia. And when I read that, what really, again, stood out was that face covering usage among the campers at that camp was very low, if it existed at all. And face covering usage among the guidance counselors was more robust. You saw a lot of transmission. That is to be compared with other examples of of cases that have been reported in camps and schools across the globe where face covering usage has been widespread, and you haven't seen these significant outbreaks like we saw at the camp in Georgia. So it's really a recognition of the changing science around this. I'm going to turn next to Steve from WMTW. We'll come back to Steve while we turn to Brooke Riley at ABC.
Thank you, Dr. Shah. As colleges get ready to welcome students back soon, even though they're taking precautions and having restrictions, is the CDC doing anything to prepare for them to come back if there's outbreaks on campus?
We are. What we've been working with many of the colleges and universities across the state of Maine. As you're aware, many of those colleges and universities themselves have undertaken very impressive and ambitious plans to conduct widespread testing across their student body, their faculty, and their staff. We at Maine CDC are working with them on a couple of things. The first is to make sure that those test results get reported electronically to Maine CDC so they can be part of our data. The second is that if there are positive cases detected as part of that universal testing process, Maine CDC has already got a plan in place with the college or university to undertake case investigation and contact tracing. We don't want to wait until we get a first positive case at college X before we start figuring out what needs to happen. The third thing that we're working with those same institutions on is what they need to do in the event that there is a positive case. So how can they start contact tracing in advance? So when Maine CDC calls and says, Joe Smith, a sophomore, has just tested positive, the college already has a list of the classmates of Joe Smith, the people on Joe Smith's floor, all of those things ready to go. So the contact tracing is that much faster. So we're working with the colleges to prepare in advance rather than wait until after there's a case.
Thank you.
I'm going to turn to Jay Mishkin at WGME.
Thank you very much. In the past 24 hours.
Are you at an arcade, Jay?
I am not. That is not coming from me. I don't know where that's coming from. Anyway, in the past 24 hours, we've heard about positive cases at 2 restaurants. Bruno's in Portland announced on Facebook it's shutting down for 2 weeks, admitting that it's above and beyond CDC recommendations. Popular chain restaurant in South Portland has told us that someone tested positive last week, but they never closed. They did a full cleaning, they said, over 2 days, but never closed. So 2 very different responses. Does the CDC believe that a food establishment can safely operate without closing even after a worker tests positive?
So it really does depend, Jay, on the particulars of each situation. It depends, for example, on how many other staff members may have been in close contact with that case. If the other staff members, if there were numerous staff members who were close contacts of that particular employee, then just by virtue of not having enough staff, the restaurant may need to close. If, for example, it's determined that the deep cleaning process may take more than a day or so, then as a result of that, the restaurant may need to close. If the restaurant has not been doing regular testing of the staff, it may need to undertake testing of all the staff, which again may necessitate closure. Those are operational reasons why closure might be necessary just by virtue of what's needed from a public health perspective. There is no per se reason why a restaurant needs to close. If they've already taken precautions, if staff members were uniformly and universally wearing face coverings and face shields, the likelihood of transmission to other staff is low. So it really does depend. Must a restaurant close? Not necessarily. Do some restaurants close? Yes. In some cases, out of an abundance of caution. In other cases, because operational forces require it. But for a restaurant that's taken all the necessary precautions in advance, again, face coverings, face masks, plexiglass shields, all of which limit the exposure to other staff members, restaurants can conceivably stay open. I want to be clear, there is no hard and fast rule on this. It does depend on the exact particulars of different restaurants. And I think that's one reason you're seeing different outcomes. In the same way that some factories, after a certain number of cases, had to close while others were able to stay open, it does depend on the layout, it depends on the preparatory steps, and it depends on the facts on the ground.
Thank you.
I'm going to turn back to Steve at WMTW. All right, well, I want to thank everyone for taking some time out of your afternoon to join today. There is a lot going on with COVID-19, both here in Maine as well as nationally and internationally in the search and development for a vaccine. The discussion around vaccine is one that is just beginning. This will not be the last time that anyone talks about vaccines for COVID-19. It will certainly not be the last time I talk about vaccines for COVID-19. All I ask is that as you are going about your lives and interacting with others in person, on Zoom, on the phone, when the topic of vaccines comes up. Please recognize that there is a diversity of opinions around this, and different folks have very different beliefs about what vaccines are and whether they're appropriate. What I like to do in those situations is not so much focus on what it is exactly that people believe, but why it is that folks believe what they do and what they view as credible sources of information. When we move beyond what people believe and start talking about why people believe the things they do, I think that's where productive dialogue starts. Whether that's COVID-19 generally or vaccinations in particular, that's the question I ask everyone to keep in mind as you're going about your discussions around COVID-19. That will certainly be a topic of conversation for the months to come, and I look forward to having it with everybody. So with that, thank you all for your time this afternoon. As always, please be kind and take care of one another. We'll talk again on Thursday.